We all know in heart attack, blood vessels get blocked. But do you know blood vessels are there in entire body, like brain, legs, hand, abdomen, anywhere. Hello friends, I am Dr. Sagar from SLVC Clinic, Vashi, Navi Mumbai. Today we are going to talk about blood vessels and how to take care of our blood vessels. We all do ECG, 2D core lipid profile test for heart, because we are very scared about the heart attack. But in heart attack, blood vessels get blocked. Similarly, we have blood vessels in legs, hands and brain also. We all know in paralysis, blood vessels of brain gets blocked. Similarly, leg blood vessels also get blocked. We don't realize it in early stage because body develops collateral circulation, and in very late stages, patient develop gangrene, that is pre-amputation stage. So at this stage, there is a possibility of amputation, that is cutting off the leg. So we all should know symptoms about blood vessel blockages. We should identify them in early stage. So we have discussed about the blood vessel blockages. Similarly, there is a possibility of blood vessel rupture where patient gets bleeding from cuff, bleeding from the stomach, that is vomiting, bleeding from the feces, that is dark color stool, or internal bleeding where patient's hemoglobin drops to quite low level. There are conditions like vascular malformations and blood vessel injuries where patient gets severe bleeding. So most common condition is bleeding through uterus, that is excessive menstrual bleeding or bleeding in between menstrual cycles. So it can be due to uterine fibroids or uterine vascular malformations as well. So if there is any cancerous growth, definitely hysterectomy is the final solution. But if there is a vascular malformation or uterine fibroids, we can treat these abnormalities with just a pinhole surgery, that is endovascular embolization. There is no need of hysterectomy. So excessive bleeding during menstrual cycle and in between menstrual cycle, it's called as menorrhagia, where we can see if there is uterine fibroid or if there is uterine vascular malformation, and we can treat these blood vessel related problems by just a pinhole, that is endovascular treatment. Third most common condition is clotting. We have seen blood vessel fresh clots, which is different than chronic blockages. Patient can get deep vein thrombosis or acute upper limb or lower limb ischemia, where there is a fresh clot and sudden clotting in blood vessels. So these are emergency situations where we need to give blood thinner medicines or we need to do some surgery, that is endovascular intervention, in hours, not in even days. So patient should reach hospital within hours and we can treat patient better if patient reaches early in the hospital. So thrombosis is a condition where any blood vessel gets blocked because of fresh clots. There are multiple reasons. There are some hereditary reasons, even tobacco and post-viral infection conditions where patient gets sudden blockages because of fresh clots, where patient needs immediate treatment in the form of either injections of blood thinner medicines or endovascular treatment or surgical embolectomy. There are certain cancers where we are doing ablation and embolization treatments where we can reduce the growth of the tumor and we can prolong the patient's life. So friends, intervention radiology includes various blood vessel related and tumor related treatments where the entire treatment is done through a small pinhole and there is no need of open surgery, and we can treat blood vessel related problems or tumor ablations. For more details, please subscribe our YouTube channel with name SLVC Clinic. If you face any blood vessel related symptom, then please consult nearby interventional radiologist or vascular surgeon as early as possible.